Okay, happy Monday, everyone. In case you're like me and needed reminding of what day it is, it's quick logistics. So for those of you who've been on webcast with us before, in terms of all of the normals, so we are recording this webcast and we will be sending out as a follow-up. So if you have staff that weren't able to make it, no worries, they can go back and watch it later, or so you don't have to feverishly take notes. You can also reference it later. We will be opening this up for questions to the audience. So in the bottom of the Zoom panel, there's two different options. You can chat us. So if you have a question or having issues, please shoot us a quick message, or you can use that Q&A panel. We will be monitoring, and we have team members monitoring both of those. That will be, so I guess we're going to make this more of a conversation today. So if you have a question that comes to mind, please make sure to just go ahead and pop it in that question. We'll get to it as soon as we can, but don't let the question slip your mind. For those of you, so just a couple questions coming in already. So everyone is also muted, so we cannot see you or hear you. Just to cut down on background noise, you'll just be able to hear those of us on panelists. So no worries if you've got, like me, a 5-year-old running around somewhere. For those of you that I may not know, my name is Saranda West. I'm the Director of Product for Daxko. My team has been working with a lot of you, or a lot of your teams, in the past several weeks to build new tools as quickly as we possibly can in terms of how we respond to COVID. And as a part of that, I've been reflecting. It was just this time last year, for those of you YMCAs on the phone, we were gearing up for General Assembly, which is the big conference last summer, and really talking through how what you do every day is evolving and responding to a world that is constantly changing. And I didn't realize, looking back, that it was going to be changing this much, and I really wish the world would quit doing some backflips on us. But here we are. We are, weeks into a quarantine or a shelter in, or depending on where you are, and COVID-19 has impacted our communities, our relationships, and how we respond to those communities. And I'm honored to be to work with all of you to do so. The amazing stories that we've heard in terms of food and childcare and all of the ways you're serving the communities is fantastic. But now we're turning a bit of a corner and shifting our focus into how we can reopen and reopen safely, given that, and really go back to how we were serving the communities before, but then also still trying to maintain how you've been serving given COVID. So that's what we're going to be focused on today. I hope by now you have all seen and read, Daxko put together a playbook in terms of reopening, compiled of a lot of different information and sources from many of you, actually. And so today we're going to be talking through specifically the plan and prepare phase of that playbook. And to help me do that, I am joined by two people, Kim Ballard, who's the COO of the YMCA of East Tennesseee, that's in Knoxville, Tennessee, and then Gloria Winters, who is the Chief Medical Officer at the YMCA of the Pikes Peak region. Ladies, thank you both for joining me.
Thank you.
Thank you for having me.
So we are just going to dive in. Again, no slides. You've all seen the playbook, and I hope read through it and making a lot of decisions and bringing back staff. And it, has got to be overwhelming. It's overwhelming for me, overwhelming for everyone as you navigate all those decisions. So we're just going to dive right into it. Actually, Kim, will you start off and just kind of tell us what the current landscape is for you?
Sure. We reopened May 1st, so we're 11 days in. We are under a county mandate. We did not follow the governor's mandate. We followed the governor's guidelines, but the county's mandate to open. So our facilities are open except for our pools. There are no aquatics in anywhere in the county open, so no pools are open. We are having Group X classes we are doing virtual and the classes at the same time. We marked off all of our Group X floors in 10 by 10 squares. Things like yoga, where people are bringing their own mats from home, and everything else. Since our pools are closed, we took our aquatic staff and we are using those as cleaners. So we have someone cleaning and sanitizing the entire time we're open. And so far we get, the masks have been a problem because people are having to wear a mask while they work out. So there was a lot of pushback, but as time has gone on, the entire 11 days, we've seen an increase day to day in membership growing and classes coming back. So very optimistic about where we'll be on May 31st when phase 2 opens in our county. And so, optimism, kind of fearful optimism is where I think our landscape is right now.
Yeah, thank you. And I know that you've navigated a lot of the decisions that we'll talk about, being one of the first to open.
We were the first to open in our state. There might have been a few otherwise that opened the same day we did, but most of them actually were opening today. So
yeah. And Gloria, what about for you? You're in Colorado Springs. What does the current community look like?
Yeah, well, first of all, I appreciate Kim taking the lead for us and going to all that work. We have very similar plans for reopening. We are not open yet. We have moved from a stay at home to a safer at home. And we're hoping that this week our governor will make an announcement about when we can actually go through our phase 1 reopening. So we have set already our standards and guidelines in place for that. But I would say in this preparing phase, since we haven't been able to open up like Tennessee has, we're really looking at what is it that will instill in our community the ability to come back once we reopen. And so looking at that, I think it's a component of trust. And Kim mentioned this, that there's fear. And so they're still dealing with that fear, even though they are open day in and day out. And so I look at that and that's where I look to inform our decision-making process. And there's 4 components that I look at: the physical, emotional, digital, and financial components, that if we can set the expectations around those 4, then we can continue to instill trust. And it really is interesting that digital would be a component that's added in there. But as we know from these last couple months, that we've had to move to these virtual programs. And so there's a necessity for us to continue to move forward in that direction as we plan for reopening. Obviously the physical component for safety and well-being, and then emotional. Everybody has a story now around somebody that's been affected either through COVID directly or through this economic crisis that we've been through. And then their finances have been affected. So we're really laying those 4 pieces out to see how we can actually continue as a YMCA to actually enhance the trust that we've already built in this community. And we've really seen that over the last couple months. So I'm sure that that's a common story across those who are on this call, that trust has been a component that we already had as our value proposition, and we're only enhancing that. So that's really the current landscape that we're seeing. And I would also add that we've had such a great history of being an industry that provides for childcare, for our older adults, for our chronically ill. But that's actually even moving now from a place of being fitness and community to really a health organization, because we're combining the components of social determinants of health, transportation, food insecurity, and we've been providing for that immensely in the last 2 weeks. So social determinants, and then we're looking at the business health component of it. How do we just run our businesses? And then we add to it now this public health component. Everybody has been aware of that with the flu, but now we've added COVID-19, this communicable disease that everybody will be talking about for years to come, because we have to. And so we've taken that healthy population that really didn't have to worry about it unless we knew somebody or had family members with chronic illnesses, and now we've layered that all together. So business health, public health, and social determinants, and that's something that now the Y will be addressing forevermore. And so when the CDC has said in the past that what affects health, 80% of that is what you would call social determinants, and 20% of that is clinical care, which is what I provide to my patients. I think that's going to actually shift to 90% of what our facilities can actually provide to improve the health of somebody. So that's a real shift as we move forward. We don't want to just reopen because we can. We want to do so with really strategic intentionality, and then have that guide our decision-making process. So lengthy explanation, but a lot of thoughts around that.
Yeah, and I definitely want to unpack some of that as we're going through. But in particular, I think, you know, in the reopening, and the key word in all of this is reopening safely. So I know there's a lot of processes that you're putting in place. And Kim, you mentioned some of them already, and even Gloria, I know you're making the plans for them. I guess, give me just the high level, and Kim, I can start with you in terms of like, are there different operating hours? How have you social distance? You mentioned the mask, which I know is maybe a state by state, going to have to deal with that. But what are some of the other things that you put in place so that as members are coming back, that trust is there?
Okay, so for one thing, I'll talk about capacity first. So we operated on a 5 people for every 1,000 square feet, and that was our building capacities. And then we did, of course, the 6-foot rule where we're social distancing. So we have markers on the floor, we have markers on the mirrors in the bathrooms, markers on the mirrors in the aerobics rooms, group X space, anywhere we have found that. The other thing we did with our facilities where we are closed an hour earlier, Monday through Sunday. So we didn't want to change too much of that because, like I said, we have our pools closed, so we felt like we had enough staff. We brought back enough staff to have a cleaner every shift that literally walks around sanitizing the entire time the building is open. We are requiring gloves and masks for our staff and masks for our participants. We are not taking the temperature of the members, but we are taking the temperature and logging it of the staff. We are asking the members the 3 questions that were provided by the CDC. Have you been around anyone? What's your exposure like? And if they answer no to all those, they wash their hands as they enter the facility, and they wash their hands on the way out of the facility. As far as the staff go, we haven't really had much pushback from the hand washing and the masks of the staff. We had been open for essential childcare since March 20th. So most of our staff had gotten used to a lot of the procedures that we were putting in place.
Great. And then Gloria, also from a planning perspective, I guess speak to some of those same things.
Yeah, sure. Looking at it from a risk assessment point of view, OSHA has some great guidelines to create a new risk assessment based off of this COVID-19 pandemic. And so I would break it into the 3 categories, which everybody knows. It's hygiene, social distancing, and cleaning and disinfecting. And then so those are the 3 areas that we've really mapped out in our risk assessment, and then put that out for both the member-facing side and the staff-facing side. So whether it's within the facility, everything is zoned. There'll be, we'll have mapped out to know how many people are in what zone at what time, and then have a rotation through that. People will be registering for classes before they come in, so we'll be able to know who and when they're coming. And then, as Kim mentioned, when they come into the facility, whether it's staff or members, they'll actually come to the hygiene station and wash hands. Our staff and members will go ahead and do a temperature reading, and then do a quick health check to determine that they have not had any symptoms in the recent history, to determine whether they can come into the facility or not. So that's how we've really mapped those 3 out, because there's so many components that we're looking at that it can create a sense of overwhelm. And we're really trying to limit that by helping staff to see there's 3 areas that they need to focus on all day long, every day. And then people know what their roles and responsibilities are, so that things aren't lost in limbo. But again, you know, Kim's functioning in the real world, real time of that. And so it's really great to hear how that's fleshing out, and how members and staff are responding. And we don't think that staff are gonna have any issues. I mean, this is part of our new normal, where you go to Home Depot and mask and make sure you're practicing all your regulations. So.
Yeah, and I guess speak to Gloria, while you're on that topic, speak a little bit to with tracking, and Kim, I know you're tracking temperatures and the symptoms for staff, but then Gloria, with you planning to do so for members, one of the questions we're getting in is specifically around HIPAA compliance and just processes that come along with tracking that information.
Yeah, so we will be utilizing a system called through Weld Health, and they have a check-in process that is that communicates with Daxko. And so all of that, once you take the temperature, will be HIPAA compliant. And we went back and forth between doing the health check and temperature check with both members and staff, just because of the HIPAA compliance. But what we're looking at with not knowing how the virus will flow in its curve and its surge, there's going to be a need long-term, so forward thinking about contact tracing. So if someone does end up from a member facing or staff facing positive COVID or even plausible COVID, then there's going to be, we have a public health responsibility to trace that, and this will really ease that. Under the CMS regulations, they have lightened the HIPAA compliance for that testing, and that's a lengthier subject, but there isn't the same regulations that we have had in the past for some of this HIPAA compliance because it is such a public health issue.
Yeah, absolutely. And Kim, in terms of, and I guess I wanted to dig in a little bit in terms of the experience and the response you've seen from your members so far. So being one of the first to open, having the limited capacity and people spreading out, like what's been the response from the community as they've been coming back in?
Well, like Gloria, we started with this has to be a place of trust, and it has to be a place that people can see exercise that boosts your immunity. And so we've really played on those two things, that we want to build a sense of trust with people, and we want to get them back to their exercise routines. We are not taking guests or outside groups. The other thing we're not doing is we have basketball, but it's just one-on-one. You can just play basketball in the gym. Basically, you're just shooting. So there's no pickup games or anything like that. The way our locker rooms were done, the locker rooms are set aside, so they're individual anyway. I guess we got lucky there. We saw a lot of terminations in that first week when people thought we were making them wear the mask. But once I think people realized, and that's why we wanted to thank the media, because they really got out in front of it. Almost every news outlet in our city shot a video from one of our YMCAs with a staff person talking with a mask on and people working out with the mask on behind them. So even in our group exercise classes, yes, the instructor is wearing a mask. It is a t-shirt type mask that the microphone fits under. All of our classes are virtual, and so there's people in the class and there's a virtual platform, so you can choose which one you want. I think people have responded very well. I think there was a lot of fear. As the days have gone on, it seems like we've been open a lot longer than 11 days, but I feel like slowly the volume is picking up, the class sizes are picking up, people are requesting personal training packages. We shot a video of how to do personal training with social distancing that just launched today. It's kind of funny. It's a little bit of a takeoff, but we've done a lot of video messaging because that seems to be what people are really attracted to.
Yeah, and I would let, Kim, could you, I guess, elaborate, and Gloria, I would love to hear your plans on this too, because so much of the trust piece and like even to the, I guess one of the things I wasn't expecting or being a little surprised is how much press you would get. And like, what has that communication been like? I guess first, let's start with, how did you communicate to members so they know what to expect when they come in? So it's not alarming. You mentioned the videos with the mask. Like, how did you, besides the videos, how did you get them prepared to come in?
So we did a welcome back video. That was just a video that we had professionally done with a younger staff person that is kind of the voice of all, that's kind of been the one voice that we've had through the entire process, that kind of told people what we were doing. We sent out an initiative that let people know. And then basically word of mouth. I think people came in and saw, hey, this is not that bad. And so they told their friends, and slowly but surely, that is really what's helping us the most.
Yeah. And Gloria, what about you in terms of like that communication plan specifically? I know with your background and following all of the guidelines so closely, like maybe not just the communication to members, but then maybe communication to, I don't know, officials, the city, just the community overall.
Yeah, we have consistent communication with both our local public health department and our state public health department, with the governor, with any of the agencies that are currently in our area, helping to navigate this. So that has been really, really significant as we've been doing our critical childcare, as we've been doing our senior outreach and engagement. So I think my phone calls with them are almost every few days to really get into the details of what's going on and how to make sure that as we plan our reopening, it stays nice and fluid. So we are having a lot of video communication. That's where we're finding our largest open rate and our responses. And then we are finishing up as we're preparing to reopen. We don't have a date yet, but a guideline for both members and for staff that is very much like our risk assessment that will really lay out how we're approaching this so that they know for certain that it will be a safe and healthy environment.
Does that, do those guidelines come with any kind of new process in terms of a new waiver that they have to sign, maybe a new orientation? Like what will that kind of coming back in process look like?
Yeah, I think it will look much like what Daxko had put together on their reopening one. Well, there's reference points so that as things change and are updated, but we will be doing waivers for our staff, checking their temperature and making sure that there's a health check. And then the guidelines of what they need to do, what their job responsibilities for social distancing, hygiene, and disinfecting are in their particular area. And then the same thing for members. So at this point, more communication is better so that there continues to have that sense. There's so much that we've lost in our sense of ability to control anything. And so if we can at least put a little control back into our community's hands, that's what we're hoping to do with more communication.
Yeah. And Kim, what about you in terms of waivers, and what is that for now that you're open? Like how's that process worked as people are coming back in, members specifically?
Yeah, since we are not doing temperatures, we're not logging those, and we are asking the questions as people come in. We are not recording those. We just, we don't, maybe we should be, but we're not. The other thing that, we feel like is that as people are really, I think our YMCA is following the flavor of the county or the climate of the county at the moment. As we see things, we're probably way more controlled than what we are seeing like at our grocery stores or at our big box stores like Target or Walmart or that. So done anything around waivers, and we are just using what we've always used because it's members only. We feel like we already have a lot of that.
Gotcha. And Kim, you cut out for just a minute, but I believe you were saying in terms of, since you're not really changing or checking new things about from the member standpoint, no new waivers or anything to take into account.
Right.
Yeah, perfect. And then in terms of, so I know a lot of it is controlled by the county and will be for all of us in terms of what those guidelines are. How have you messaged that to members, or maybe even handled situations as members are in the facility? Maybe I don't want to wear my mask as I'm on the treadmill. Like, how have you had those conversations with members if they didn't want to comply to those guidelines?
We held to the fact that adults were going to take personal responsibility, and we instilled that in our staff. We did a lot of staff training prior to opening around how to handle that situation. We developed a question and answer for staff and worked on scenarios around that. And honestly, we've had about 4 people out of all 5 branches refuse to wear the mask, and we simply asked them to leave. And it wasn't an argument. It wasn't a fight. It was just, hey, we understand, we're sympathetic to it, but the mask is a requirement in order to work out. And they might not have left happy, but they left, and they came back. A lot of people have gone out to their car, got their mask, and came back in. So it's really not been the fear we had over, oh my goodness, we're going to enforce that. It just wasn't there. People were very socially responsible themselves, and we have not, most people have really self-regulated. It's been interesting to watch. So they'll even have, a group that used to sit in the lobby and drink coffee. Now they're 6 feet apart. They're not necessarily drinking coffee, but they're sitting out and they're having conversation. They're in community, and that's what we want. Safely in community.
Absolutely. And Gloria, could you, because we're getting a lot of questions in terms of like the mask and hand washing and sanitation and CDC guidelines versus state. Will you kind of just walk us through, like, from your perspective, how to manage and take in all of the incoming feedback and recommendations we're getting from all those different sources?
Yeah, absolutely. And it is confusing. So those questions are completely valid. CDC and OSHA have been setting up our guidelines and regulations, and then most states have been falling somewhere underneath that. However, not all across the board, not all states, not all municipalities either. So first and foremost, check your CDC and OSHA guidelines. Right now, CDC says, according for masks, for exercise, if you're in a community-based environment, then it is best practice to wear a mask. Now, they're not mandating that. They're not saying that you have to. That might change. But as of right now, if you look at how they're recommending that for exercise outside or inside, they're saying double the distance if you're exercising outside without a mask. So it'll be interesting to see as nationally we start to open up more facilities if they put something in place. And then Kim is right, each local area, this is a really interesting time for our health as a nation and as a local entity. We're really seeing that health is run at a state level, and those decisions are being made there. So keeping in contact with whatever the state is doing is really going to be where you're going to have to follow those recommendations to maintain best practice. And you know that masks do not prevent you from getting the virus through the mask. It prevents it from transmitting it out. So we really have to make sure that we say, yes, here's the reason why we're wearing masks, and let's not use it as a false sense of security that we're actually really protecting from full transmission. In response to gloves, the gloves are typically used in the health system for a treatment technique. You put the gloves on, you do the treatment technique, and then you take them off, and you've done that in a sterile fashion. In this case, you're wearing them for a lengthy amount of time. So as soon as you touch an object or touch your face, then the sanitation of those gloves is now, or if you haven't put them on correctly for that matter, the sanitation of those gloves is now gone. So it's the same thing as, we're not at this point, we'll have gloves handy, but we're really using those as a treatment technique, if you will. So if we need to do something with a kiddo, or as our facilities are cleaning and they're in contact with all of the substances all day long, every day, those are really the instances that we're saying to use it for. However, if the community needs to see us wearing gloves for their safety, then we will wear them, and we will really train in the usage of them. Again, touch the face, you're done. Touch the object, you're done.
Perfect. And will you elaborate a little bit in terms of, like, since you will be checking members' temperatures and just that process, and expand on it more from a sanitation perspective as well, and maybe other, because I know that that area in particular probably has extra sanitation practices in place. But, and then also, let's say, what is the plan if someone does show symptoms or does have a temperature? What is that process going to look like for members?
Yeah, so upon entry, the member will sanitize their hands, whether it's through a washing station or disinfectant station, and then come to the, and that's the beginning of the hygiene station. And then they'll go to the person that's checking temperature. So it's one person that's consistently doing that, so that there's not a change in and out of touching objects. Again, the number one thing for clearing of this virus is washing hands. And so we're really holding to that streamline. And so it's the one person checking the temperature, and then that will be automatically logged into the Weld system. So hoping to have less people tracing. If we see someone has a temperature of 100.4 or greater, then we'll ask them to leave. And right now the CDC recommends 3 days before they can come back, that they need to be symptom free. If that changes, earlier on in this situation, it was 7 days, 14 days, now it's back down to 3. So that's kind of what we'll hold to. Did I answer all those questions?
Yes, that was perfect. And Kim, if you will, I know the member temperature is not a piece, but talk a little bit more about in terms of sanitation. So besides the gloves and the mask, like you had mentioned to me earlier around different just sanitation efforts that you're doing across the board for the facilities.
Sure. We added in all of our branches a piece of machinery called AirFix, AIRPHX, and I'll be glad to send that out to everybody afterwards. We had put one of those in our downtown mall a year ago because our downtown was an older facility and we were just looking at cleaning the air. But this is a machine that pretty much you set near your air conditioner unit, and it helps to just filter and clean the air nonstop. The other thing we're using as a sanitizer is called Ionopure, IONOPURE, and that is a local Knoxville company. However, they are all over the world. They're using this product in hospitals, children's hospitals, a lot of businesses, and we are putting that through an cool air mister, and that is misting as people come into the facility, and it just helps. And we're also using that as a sanitizer in the spray bottles because the first 2 weeks we did bleach and it was killing the staff's hands. And so we're rotating between a product called Q66 bleach properly done, and then this Ionopure. So it's been good for us. Much like Gloria, the gloves are, if we are wearing the gloves, we've done a lot of training around the proper use of the gloves, especially in our child care, which they were used to wearing the gloves anyway for snack distribution and things like that. So the gloves have not been as big of an issue either, but I think it is good for your members to see that there's someone constantly cleaning. We've done a lot of social distancing, like all the equipment on the wellness center, there are markers every other piece of equipment. And
Oh, I think, Kim, we lost you for, oh.
Can you hear me now?
Oh, yeah, you're back now. Keep going.
And we rotate, but that
Kim, you're still cutting out on us. So I'm going to, well, maybe your internet catches up. I'm going to shift over to Gloria. As Kim was mentioning, Gloria, specifically around sanitation, and they've put the 2 new measures in place, which is fantastic. One specific question came in around gloves, and instead of taking off gloves, but they've seen people use hand sanitizer on top of the gloves. Is that an okay practice?
Yeah, because it would be as if you didn't have the gloves on and were using the hand sanitizer. Yep, that's fine. In addition to what Kim was saying, we are using the electrostatic sprayers. They look kind of like the Ghostbusters backpacks that we used to see. So we've had plenty of jokes around that to lighten the mood. But those are really nice because they actually spray around the item. So if we're just going in immediately after the class and spraying the hand weights, it'll actually wrap all the way around it. And then it has its own dwell time, and so it's just minutes before we can actually use those hand weights or items, pieces of equipment again.
Perfect. And then Kim, I think we heard most of what you said. You cut out there for just a little bit.
Yeah, sorry about that.
No, you're good.
No
yeah,
way.
You're good. But we heard everything about the 2 new sanitation places, and I think you were couldn't actually catch the last part.
Yeah, so we're spraying that and we're moving the equipment. So every hour we are changing out the equipment, and that's twofold. One, to deep clean the pieces that were being used in that hour, but two, to kind of equal out our fitness equipment so we don't get more miles on one than the other.
Gotcha. So we're also getting a lot of questions, and I know the sanitation piece is a big, goes hand in hand with the distancing. What, Gloria, you mentioned Weld Health. Are there other software tools that you're using? So to just manage like or Gloria, in your case, plan on using to manage capacity or Group X classes, anything else that's helping you support that limiting of the capacity?
Yeah, I believe, so we're using Daxko, and they have a new checkout system. And so that way we can monitor at all times, not only how many people have come in, but have checked out, so we can make sure we understand truly what our capacity is at. And then Group X Pro for registration, we're still working on fine tuning all of those components, but we'll be doing that registration process. And so we're seeing that all of these systems can communicate together, which is really key for us.
Absolutely. And Kim, what about you? Is there any new software needs?
We did not use the building capacity because our buildings are larger buildings. And so when we ran the numbers on the 5 to 1,000, even in our high times, we were never pushing the envelope there for full capacity of the buildings. And for our Group X classes, it is first come, first served for now. That is something we will look at as the classes start picking up in the volume. We've not run into that yet. We've had a couple classes that's had 8 to 10. But the bigger classes where we knew they were going to be, that used to have 65 people in them, and we were expecting a 50% capacity. If that, we moved those classes to like our basketball gyms, since we're not doing much in the gyms, but pick up basketball. We limited to the classes, and that's worked out really well. People, I think there's a sense of comfort in being in a bigger space. So that has helped us with getting people back into our Group X classes. But for now, it's first come, first served.
Got it. And Kim, you just mentioned, so I know you're 11 days in, so some of this is, as we've talked about, trust is still building, people are word of mouth and coming back in. What has been, I guess, like the normal just check-ins or anything that you've seen, I guess, compared to what would have been normal? Like, what's the flow of traffic been like?
So we've been tracking that on a daily basis, and it make you stay up at night if you listen to it, but last week we were at about 28% of what we normally were seeing. So people are coming back slowly, very slowly. So don't be shocked by that. The other YMCAs that I've talked to that are in close proximity to where we are, that had even less cases than we had here in Knoxville, some of the counties, some of the YMCAs in Tennessee have had little to no cases. And so they thought they would open the doors wide open and people would flood in. That's not happening. So you got to be okay with the slow, kind of the slow uptick of people. But what that's done is they become your greatest ambassadors, because they go back and say, oh, hey, that wasn't so bad. We've moved out classes outside whenever we can, so that those classes have huge numbers in them. Any class that is promoted that's going to be an outside class in the parking lot or on the facility somewhere, really, but now those are the classes that's had 15 to 20 in them.
Yeah, and I'll add to that, Saranda. So we are not allowed to open our facilities yet, but we have an exception to that rule from our governor that personal training can be run. And so we just got that allowed last week. And so we are already planning to launch. It has to be a 4-to-1 ratio. So we're planning on a bunch of 4-to-1 ratios. And in this particular exception, we could run it indoors or outdoors. I think with our weather improving, we'll look to run as many of those outdoors as we can. And that'll really help. And then I would add to what Kim said. So she's exactly on point across the board nationally, whether it's YMCAs or other for-profit fitness industries. It's looking at a 30% return rate. And I think what is okay about this is we're all going through a phased reopening. And so it really allows us to work out the kinks of how to do this process, because even though everybody on the call is listening to what Kim and I are planning, it's going to look different based off of your area and how hard you've been hit, and how the community is really responding. And so she's exactly right. I mean, a phased reopen, we get to figure things out, plan for about 30% of your normal, and then that'll make sure that we do it in a safe and healthy way, and then those people can be ambassadors for us and grow back as quickly and safely as possible.
And Gloria, while we're on that, in terms of, do you or foresee any changes related to your pricing or membership structure, or maybe even in your personal training example, is it the same model as you had before?
We're having a lot of those discussions every single day. In fact, even this morning, that was part of it. So yeah, we're trying to interpret that based off of our particular community, and because we are for all, we're really trying to make it accessible for those that have been struggling. So we're not firmed up completely yet. I think that'll come as we actually get an opening date, but definitely in the discussion.
Yeah, and Kim, what about for you? Any changes to membership structure, pricing, any of those things?
Like most of you, we did a Stay With Us campaign, which really worked out really great for us. We were really surprised at the amount of people that did stay with us. Every Monday morning we held our breath and counted heads, but it was and so we feel like that we are going to look back after the month of May and work on a plan to reduce people's membership that did stay with us until we've made up for the month and a half loss that we were. So we're going to kind of extend it out so that it doesn't hit us all in 1 month, because we talked a lot about putting it at the end of somebody when they're going to terminate. But usually when people terminate or leave us, it's because they are leaving the city. And so that doesn't do them any good. So we want to thank the people that have stayed with us and find a way to reward them, for lack of a better word, but to make them whole again, to make us whole again. So that is part of our recovery, is to find a way to say thank you in a monetary way to our members who stayed with us.
Yeah. And I know those, maybe it won't continue as a Stay With Us campaign, but some different type of campaign as there's new needs in the community that are not going to go away until, for some time. Do you have plans from a campaign perspective to continue something there as well?
Yeah, my boss says that we're going to adopt a line from Game of Thrones: winter is coming. And so we need to make sure that that was a season premiere, by the way, if you want to watch it, that we are going to prepare the best we can now for a possible shutdown again in November and December, and what that looks like, and what did we learn from the first go around. And so we've kind of adopted the survive, recover, thrive. And that's the kind of phases we're looking at. And we're in the survival phase now. And as we look back at what we should have done and could have done and didn't do and want to do in the future, we will look at that. So I feel like that, if and when this happens again, then we will be in a much better place than we were this time.
Yeah. And Gloria, if you will speak to, just based on your experience and medical background, what maybe speak to, I know we can't predict the future, but what you're looking at months out in terms of, would there be another surge, and how we can learn from what we just went through?
Yeah. I'll get my crystal ball out here in a second.
I know, right?
and look in that.
Please do.
What we do know is that, again, as I said at the very beginning, the communicable disease is now going to be lumped in with chronic disease and social determinants. And so it was a category that was just a side note, and that will no longer be the case. And so we really need to have our decision-making process of what we think is coming informed on all three of those put together. So I know that there's lots of questions about the at-risk populations, because now they're kind of in a triple fold. So, they have diabetes and heart disease, and now they don't have a job, now they don't have food, and now they are concerned about COVID. So you add that in as one section, and if we looked at chronic disease being 60% of our population, those with one chronic disease, now you lump in the concern of the communicable disease, and that's only going to escalate our healthcare costs, which actually is that direct correlation to now our economic crisis, where before that they're tied, but they weren't quite the same tightrope. And so we really need to look at that component. And then we take all of our health seekers. So our health seekers, they would think about that category, but they were separate entities. Now all those health seekers are thinking about communicable disease as well. And then they're thinking about their loved ones, chronic disease. So we really need to rethink our strategies going forward, because we don't know what the curves will look like, what the surges will look like. But what we do know is that these categories are now living together and they won't go away. And so I think we can actually strategize for what opportunities that we take as YMCAs and really capitalize on for the health of our community that will be a lighthouse going forward. I mean, the stories are out there on this call, I'm sure, of those who have done significant food deliveries for communities, and the child care work that we've done. So those are already stories out there, and I think we just need to push the envelope on a delivery system that really tightens that up. And I would say, again, we don't know what the curves will look like, but what we do know is that at the state level and at the national level, the focus of resources on health is more than it ever has been, and will continue to be that way. So we need to find those venture capitalists, those agencies that want to invest in us, because we are a health organization that is really affecting our community for the good.
And the one thing we have seen over the past weeks is the YMCAs and the JCCs, even if we don't have our crystal ball, like we have shown that we can adapt and just evolve into whatever the community needs us to be. So, I mean, I think that's the positive, is all of what you mentioned, all of the beauty and all of the fantastic stories of just how the communities have been supported during this time, which is key. Mm-hmm. And so we're getting in it. We're kind of coming up at the top of the hour. I want to go back maybe to fit exactly in the flow, but ask a couple of questions that we've seen from several. And Kim, this one's actually for you, specifically to why you did not open the pools. If you could just talk a little bit about that.
We are under a state mandate. The governor, no pools in Tennessee are open. And if they do open in phase 2, it will be for adult lap swim only. So we are anticipating no opening of our swimming pools until probably August, or to the general public, which is not great, but at this point, being open for adult lap swim would be great.
I know, and I'm in Alabama, so not having pools in the hot part of the summer is not going to be fun for everyone. But Gloria, what about you in terms of pools? Do you have any sense for what those guidelines are going to be for you?
We have not heard anything specific from our state level, but we are planning on opening our pools and having lap swim, things that are definitely separated out to less groups.
Great. And then similar question in terms of what are the maybe Gloria, will just stick with you in terms of child watch. So having kids come in, being to watch them, and then the second piece of child care. So going into summer camp, kind of what do those plans look like?
Yeah, we do currently have our critical child care that's open, and we've been expanding that since we went from a stay at home to a safer at home. We see the need increasing. We have just been able to reserve sites at our schools for some camps. So we're working on that diligently every week to make sure that we can have those offerings for those kids that need it. We are looking at our camp up in the mountains as well. So we have our scenarios planned out for how that will open, and we are maintaining some registrations with groups at this time. So we're making all those plans for that, and we won't have childcare opened in phase 1 of our reopening with the fitness facility, the healthy living floor. We're looking to do that in phase 2, and we've marked out our phases into 2-week phases. And I think someone was asking me the question today, why did we mark that out into 2-week phases? And really it has to do with the link back to COVID and how we track it based off of a 14-day cycle. And so those are the ways that we're looking back to the data to show us that we're headed in the right direction.
Perfect. And then Kim, what about you for the childcare side?
The one thing I didn't mention is we have limited our workout time to 45 minutes per member. So we have 40. So we did not open our Child Watch, but that was also under the governor's mandate to not open Child Watch. We are probably not going to open our Child Watch until August because we have essential childcare in our branches. When we pivoted, we don't normally have childcare in our branches. So we are going to operate with essential childcare for as long as possible because our summer camps are not looking like they're going to open in our state or an overnight camp. So that's still being talked about and debated. So we want to continue what we're doing in childcare because we are serving 300 families and we feel good about that. So we wanted to keep doing that. The other thing we're doing that's kind of unique is starting this week, we're having senior hours for just people 55 and older. So that we'll see how that goes in the next week and if that encourages the seniors to come back and come in. But ironically, they are the people that have come back to us. We thought they would be younger adults, and it's ironically been a lot of seniors.
Perfect. And then I think we have time maybe for one more question. Still a lot are coming in terms of like maybe even piggybacking on that, the senior population, those, Gloria, you talked about those with the preconditions that are just going to have to still play it safe over the coming months. How do you see the virtual content that everyone's done a fantastic job of shifting to during our shelter in time or quarantine time? How do you see that, I guess, getting into normal moving forward? Kim, I'll let you go first.
Yeah, we plan to continue our virtual platforms, and we're doing everything from Group X to story time to we're doing a healthy weight management class through Zoom. We're doing a book club through Zoom. So we plan to continue the virtual platform, maybe a little selfishly because we want to be ready for the next time. We want to have a bank. So even classes that are having people in them, we are still filming them live on Facebook in order to create a bank of classes to upload to our YouTube channel. We're also doing that with people reading books to kids and classes that we're doing. So we plan to continue to improve our virtual platform. That is definitely high on the list of things we're doing.
Great. Gloria, what about you?
So we are going to continue our virtual platforms as well. What we're really looking at is the business model. How do we actually take this from something that was a critical offering that we had to turn very quickly and do at scale, and then make it something that will be profitable for us as a business. So that is the key that we're looking at. Part of the discussion is really looking at maybe a 30, 60, 90-day model. I mean, this was offered complimentary. Can we move it to a subscription base? What does that look like? Making sure that we have the quality that we need to make sure we're pressing that forward because it's not going to be something that goes away with the if and when COVID continues to plateau out and stay stable. We've seen this with telehealth. So if anybody's looking at how to do this, really look to the telehealth industry and how they're getting covered for payment on that, because that has actually changed rapidly. Telehealth used to be, 20 visits a week for any given health system. Now they're up to 1,000 a week and more, and they're being reimbursed for it. So something to really look at, how do we model that and then make that something that is part of our inherent offering? So do you package it into the normal membership that they get with an ad, or do you do an add-on? What does that look like? What does it look like for your different populations? So that's where we're headed with it, as a both as something that was an offering because it was a necessity, and now it's something that we need to look at for our recovery of business.
Sounds like something to go in the next version of the playbook as this thing continues to evolve and we navigate it. Final question, then we'll wrap up. Gloria, stick one with you. In terms of staff, and I know that a lot of YMCAs have had to furlough staff during this time. Like, how have you seen, or Gloria, in your case, how are you planning from a staffing capacity to change? Like, or what has that process been like as you're bringing people in with all these new processes?
For us particularly, we of course furloughed quite a few staff, and then we were able to bring back quite a few to work on projects, work on some of these virtual programs that we've been developing. So we have a bit of a window because we haven't opened yet to determine what that looks like when we bring people back on. So we haven't yet been able to finalize that, but it's all up in the air. I mean, that component is up in the air for really determining what the needs are. If we see 30% come back and then 2 weeks later we see maybe a total of 50%, if we're building back in the right direction, then we'll be able to maintain quite a bit of our normal capacity.
Kim, what about you? What's the staff coming back in? I know we have to check temperatures and different things, but in terms of maybe additional housekeeping or just to the sanitation pieces that you mentioned.
Sure, we did that too. We laid off a little over 400, and we brought about 386 of them have chosen to come back. So that's good. And we're not, I wouldn't say we're completely overstaffed, because from working childcare, we also are working, our camp has a 1-to-9 ratio. So there's one staff person for every 9 kids and a cleaner. So we've had lifeguards and wellness floor staff and membership staff. So we've been able to work everybody fair and equitably around 6 hours a day. Some people have worked up to 8. So we feel like as we start, as the volume picks up, we can stay on this path. If the pools did open, we still feel like we have enough people to do the proper sanitation, proper cleaning. At that point, we might look at our hours a little differently. We were trying to get back to a rhythm in staying open when we did, and only closing in that last hour. But that is something we've actually talked about for sure.
Yeah. So we have just a couple of minutes before the hour's up. I just wanted to say thank you to both of you so much. I know this has been helpful. So many questions we didn't get to, so we'll maybe try to figure out how to get those answered. But I know this was helpful for a lot of people. And just thank you so much for sharing both of your expertise during this time.
Thank you.
Thanks.
Yeah. And for those of you listening, as I mentioned, both ladies were involved in what we've been talking through is the Re-Opening Playbook. If you haven't had a chance to take a look at that, you can find it on our website at daxko.com. It's on that main, in the middle there on the main page, or there's a specific page for COVID-19 as well. And it takes you through all of the different, in this case, we're mostly talking about planning and preparing, but then we'll have more information coming soon as we are going through all of the other phases. Thank you all so much for joining us today. And again, we recorded this, so if you happen to miss out on some of the content, we will send that on so you can consume it later. Thanks so much.
Thank you.